Speaker, again to the Premier, since I can't get a straight answer on the transportation file, let's try health care. I want to share with you the effects that the Liberal government's cuts are having on doctors. I will share with you what was written by Dr. Priya Supel, a family doctor for the last 22 years in Brampton. She says patient care will be compromised. Patients will have to wait. Patients will not hear a familiar voice at the other end of the phone.
Excuse me. Deputy Premier is warned. Carry on.
They will no longer have a dedicated person at each office doing referrals to ensure patients are seen in a timely manner. She said if the Ministry of Health thinks that cuts will not affect patient care, they are wrong. Mr. Speaker, is Dr. Supel of Brampton wrong when she says the government's cuts are going to affect patient care?
Mr. Speaker, I will just say to the Leader of the Opposition, I know that the Minister of Health and Long-Term Care is going to want to weigh in on this because he is in conversation with the OMA, Mr. Speaker. We value our doctors in this province, Mr. Speaker. That's why we have increased health care funding every year, Mr. Speaker. Increased health care funding across the board, Mr. Speaker. We know that there are challenges that are faced by the health care system. We know we have an aging demographic, Mr. Speaker. We know that doctors obviously are a fundamental part of the delivery of health care, Mr. Speaker. We've engaged with doctors. The Leader of the Opposition is asking that and believes that we should be paying doctors more, Mr. Speaker. They are the highest paid physicians in the country, Mr. Speaker, and so that is evidence of how much we value them. We will continue to work with the OMA, Mr. Speaker, because we do value them so highly.
Thank you. Supplementary.
Mr. Speaker, back to the Premier. What I'm saying is that you can't take $800 million out of the healthcare system and think it doesn't affect patient care. Dr. Supel continues, they will not be able to offer blood work to their patients. They will no longer be able to call patients to remind them of their upcoming appointments. They will no longer be able to deal with prescription renewals over the phone or fax. The staff will be rushed and appear not to care. But unlike the Premier, Dr. Supel and her staff do care. They care about patients. Mr. Speaker, what does the Premier have to say to Dr. Supel and her patients? Should they ignore your cuts? And don't pass the buck to the Health Minister. There's not a single doctor in this province that supports these cuts.
The Deputy House Leader is warned. Carry on.
Long-term care.
Well, Mr. Speaker, I'm extremely proud of the fact that since we came into office in 2003, we've increased the supply of physicians in this province by 26%. More than 5,000 new doctors are practicing here. And when you compare that with the growth in population over that time has been roughly 10%. So we've been adding doctors and continue to add doctors at the rate of 700 net new doctors each and every year, and that's important so we continue to provide that important frontline care. And consistent with that increase in flow of doctors providing that frontline care, every single year since we've been in office, we've increased the budget for physician services, as we should, to take into account the growing population, the changing demographics.
Answer.
We increased the budget last year for physicians. This year, next year, I expect that will continue into the future.
Supplementary.
Mr. Speaker, again, back to the Premier. You know, to hear this spin again and again and again, what I have not heard is an example of a single doctor. There's 26,000 doctors in Ontario. One example. Give us one doctor outside this legislature who actually supports your cuts. You know, it's bad enough. It's bad enough when this government has done to family doctors, but they're hurting entire regions. You know, Linda Silas, president of the Canadian Federation of Nurses, said In North Bay and across Northern Ontario, we are seeing severe cuts. North Bay Regional Health Centre was forced to cut almost 160 positions and close more than 30 beds in an attempt to stave off the flood of red ink. Sudbury and District Health Unit laid off 4 more employees just last month.
Question.
Dr. Andrew Tu from Timmins has warned doctors will leave the city because of the cuts. You think this is all a joke? You are hurting and damaging health care. How do you defend it? How do you justify